Us today, we're going to be discussing ways to boost fertility and ways to manage menstrual cycles. I'm Dr. Molly Force here with Prosper Natural Health, and we've got a wellness center here in Port Townsend, and I'm joined today by Doctors Mary and Doctors Rosalie, and we are looking forward to talking about this topic. It's one that is really an important one for a lot of people, and one that as we were diving into the information about, we really realized how many things can become obstacles for women in particular while going through the fertility process. So we're excited to share some of our input today on things that we've seen to be really helpful for our practice, and we hope that you get a lot out of it. So we're hoping to cover ways that will help you recognize hormonal imbalances for yourselves, and looking specifically at the menses cycle and all of the wonderful information that the menses can impart to you. We're also going to be talking about ways to evaluate infertility and looking at menstrual irregularities and what they might be trying to tell you as signs from your body. And then, of course, we're going to be sharing with you some of our favorite ways to really support your cycle and really boost fertility. So just to get started, we want to make sure that we cover some of the basics. So thinking first about female reproductive anatomy, we've got the uterus here, this beautiful organ, which contains these fallopian tubes, which go out to the ovaries, but they start way down in the vaginal canal with this cervix. And you can see that cervical opening there, and that allowing when we're talking about fertility, allowing sperm to come up and through and implant here as the egg is going to travel through the fallopian tubes from the ovaries. So it's important to recognize that the brain is very much involved in fertility and our cycles, and it starts up in this hypothalamus and sending down these signals to our pituitary, and those release more hormonal signals as LH and FSH, which then in turn signal to our gonads, whether we have testes as males or ovaries as females. These are going to help inform our cycles and help those gonads make more hormones and produce these sex hormones that all of us are have heard of, as far as estrogens, progesterone, and testosterone. So there's a complex system that happens as more of these hormones are produced. There's a feedback system to the brain to tell it to balance these out. So with the menstrual cycle in particular, we've got these different surges coming from the brain, coming from the pituitary gland throughout our different days. So if you're visual here, we've got a little ticker of our general 28-day cycle, and that tends to line up often with the lunar cycle of being around 28 days. And for most ovulating persons, they are going to be having these surges of this FSH and this LH, which is going to impart information to the ovaries to begin the stimulation of the follicle growth. And then we have this signaling also affecting the endometrial lining, so the lining of the uterus. And so one of the really important things we like to look at with our patients is the length of the cycle. Is it 35 days, 22 days? Are we going through this entire shedding of the lining very fast, or does it take a long time? Are we having periods that are what we call anovulatory, which means that the eggs themselves aren't being released and we're having these very long cycles? We also want to know how heavy is the bleeding, and that helps us understand this release of the endometrial tissue and how much sloughing of that uterine lining is happening. We want to know if our patients are experiencing these premenstrual cycle changes that can often be mood related. And also we want to know about cramping, because that tells us quite a bit about what the spiral arteries of the uterus are doing as they're trying to clamp down and stop that bleeding. And then we want to know what that consistency of that fluid that's coming out in the menses looks like. All of those are going to be really important signs for us about what's going on with that beautiful organ of the uterus. So when we're thinking about what we consider a normal, healthy menstrual cycle, typically we're looking at about 2 to 3 tablespoons of blood coming out, which equates to usually about 2 menstrual cups, which are usually about an ounce a piece, and or up to 9 soaked regular tampons or 9 soaked through pads. So that's typically what we're seeing, and they can take between 2 and 7 days to complete that shedding of that lining. And the cycle itself for an average person is somewhere between that 21 and 35 days, with the average being closer to the 28 days. And if you know that you tend to have cycles that are irregular and that are not following in this pattern, then that may be predisposing you to have challenges when you are ready to go through your fertility stage of life. So that's one of the reasons why we're going to be talking about these important signs today.
So when it comes to infertility, the diagnosis gets made when, depending on a person's age. So under 35 years old, you can be diagnosed with infertility if you're unable to conceive after actively trying for 12 months. Over 35, the definition changes, and it's the inability to conceive after 6 months. So the statistics are such that, above age 30, you have about a 75% chance of conceiving during that year. This drops down to 66% by age 35 and 44% by age 40. So, less than 1 in 2 women who are trying to conceive are having difficulties at age 40 and above, that is. And all of this is due to a lot of different factors. Fertility just declines with age. Our most fertile periods are in our late teens, early 20s. Ovaries sort of decline their production of making eggs until the menopause time, which on average kind of starts mid-40s, with the average age of menopause being 51. Hormonal changes, however, during the earlier years, pre-menopause, are a big piece of female infertility and difficulty, both female and male infertility here as well. So when it comes to female factors, we'll just touch on those quickly, and then we'll talk about male factors. The most common causes of female infertility include endometriosis, which is essentially an estrogen dominant state, which really builds up the uterine lining and causes pelvic pain. And there's other areas in the body that are also growing uterine lining, and it's leading to a lot of inflammation that then is difficult for conception. PCOS is also a huge one. I think the statistics are such that maybe 5% of fertile or fertile aged ladies have PCOS, which is just an acronym for polycystic ovarian syndrome. It's when the ovaries are trying to pump out an egg, but it doesn't quite make it out. And it means that there's essentially an anovulatory cycle. No ovulation happens, hence we can't conceive. Fibroids are another big piece here. There's sort of a growth that again kind of leads to inflammation and difficulty mechanically with conception. Scar tissue due to previous abdominal surgeries, or just chronic inflammation from the, things like pelvic inflammatory disease can also contribute. And then a big one here is thyroid disorders, right? Our thyroid is our metabolic organ. It's sort of the brain that tells the hormones essentially what to do, including metabolically. So those are the most common causes. When I see a young patient come in with fertility questions, we do a thorough workup looking at all of these things. Other less common causes include just functional low progesterone, which can be paired with estrogen dominance, autoimmune conditions, premature ovarian insufficiency, hyperprolactinoma, etc. Those are kind of things that are less likely, but still are things in the back of our mind when we're working up at this type of patient. When it comes to male factors, we've got to remember that it takes two to tango ultimately, and that the male piece of fertility and infertility is enormous here. About 40% of infertility cases have to do with the male partner. Causes are multiple, congenital being one, just general hypogonadism. Hormone imbalances are also a huge one when it comes to testosterone therapy. If someone's trying to boost their testosterone, that actually diminishes fertility quite significantly. Estrogen dominance, even in a male, can be present, and we'll talk about that more from a xenoestrogen perspective later. Same thing with prolactin, another one of these hormones that will stimulate estrogen in a way that's not favorable for fertility. Again, going down the list here, drugs and medications like testosterone treatment, opiate use over time diminishes fertility greatly. Environmental toxins includes those xenoestrogens. Systemic illness, right? If you are nutritionally deficient, you don't have enough zinc, you don't have enough selenium to sort of make healthy sperm that can swim up into where it needs to go. And then lastly, sort of infections that can affect sperm production are obviously huge, not just infections earlier in life, prior to the conception phase, but sort of actively as well. And then lastly, mechanically, if there's erectile dysfunction, it's difficult to procure the sperm that is needed.
Okay, so now we're going to dig into some of the more common causes of infertility and of menstrual dysfunction in general. You know, what causes menstrual cramps, what causes the most problems within the menstrual cycle. So we're going to first start with endometriosis. Shockingly, endometriosis is a condition that very few people have even heard about, and it's estimated to affect 10% of menstruating women. It is, as Dr. Rosalie was saying, it's caused by a growth of the endometrial tissue, so that tissue that lines the uterus and then sloughs off and causes a period at the end of the month. That tissue can grow outside of the uterus in the pelvic cavity, on our intestines, on our bladder, and can cause many different issues depending on where it's found. This takes a really long time to diagnose, partially because we often consider menstrual cramps normal, even these debilitating severe menstrual cramps, and partially because of the challenges with identifying it with standard imaging. So as we go through our menstrual cycle and our uterine lining grows throughout the month, all of these other pieces of uterine lining tissue that are in different parts of our body can respond to estrogen and grow in response to that estrogen. So, and one of the factors that makes some people develop endometriosis and others not is whether or not your immune system recognizes it as something to grab a hold of and get rid of, or whether it responds to it as wound tissue. When it responds to it as wound tissue, it can build up, it can try to heal it and build up all kinds of scar tissue and blood vessels around it, and that can cause more problems. That can kind of start to impinge on the areas around it, and often will affect nerves around it and cause a lot of nerve pain and a general inflammatory response in the pelvic region. So the symptoms that will tell you whether or not you have endometriosis are if you have really severe pain with periods. You know, this is like a 8 or 9 out of 10 in severe cases. And often many women will miss work or have to be in bed for days on end at the start of their cycle. Other symptoms, again, depend on the location of those endometrial pockets. And that can cause pain with urination or with defecation, can cause changes in your bowel movements like constipation or diarrhea. You'll often see really heavy menstrual bleeding, and then nausea and vomiting during your menses, as well as fatigue. And then because these lesions can often cause scarring and additional issues within the uterus, it often leads to infertility. Okay, next major diagnosis that's often associated with infertility is PCOS, also known as polycystic ovarian syndrome. This is the most common endocrine disorder in women, and the pathogenesis, or what the underlying mechanism is not really well understood. But that's why we call it a syndrome of associated features that we commonly see in many women. And it includes irregular or missed periods, signs of high testosterone. So high testosterone will often lead to acne, hair growth on the chest at midline, as you can often see in men and other people with a lot of testosterone, hair on the back and jawline, and then male patterned hair loss, which is top of the head hair loss. With an ultrasound, or the common imaging that we use for these things, you'll often see multiple cysts on the ovaries. So in a normal menstrual cycle, you'll have one ovarian follicle that gets larger and eventually releases an egg. But in this case, you have many follicles growing, and it prevents any one follicle from completing its growth and releasing that egg. And then lastly, we often see obesity and increased fat tissue, and blood sugar dysregulation and insulin resistance. All of these factors are interrelated. So the testosterone, the blood sugar dysregulation and insulin resistance will affect our hormones and affect the ways that our ovaries release estrogen and progesterone to kind of cause this ovarian dysfunction. All right, and then here we have uterine fibroids. This is one of the main causes of severe cramping and heavy bleeding. It's very common. It's actually seen in 20 to 30% of menstruating women, and it it consists of these solid masses of fibrous and muscular tissue that form within the walls of the uterus. And they can be really small, so, a penny size, to some will get as large as a basketball and cause significant problems. So they can interfere with the shape and anatomy of the uterus and block the fallopian tubes. They can block the cervix, and prevent any movement of sperm or the egg, and preventing implantation. So again, the symptoms and how you would know if you had uterine fibroids is you have severe cramping, heavy bleeding with menses. This often leads to anemia in many women, and then abdominal masses that, when they get large enough. The diagnosis for this is often an ultrasound, which is a relatively non-invasive form of imaging. All right, and then here's a curveball. Hypothyroidism is often plays a huge factor in menstrual cycle irregularities and infertility. So the most common form of hypothyroidism is Hashimoto's thyroiditis. This is an autoimmune form of thyroid dysfunction where your body is attacking your thyroid gland. And interestingly, hyper and hypo, or over-functioning or under-functioning thyroid, is linked to abnormal menses. And this is largely because of this hormone called prolactin that is affected by the thyroid hormone. And it's associated with reduced fertility and an increased risk of miscarriage. So if you're trying to get pregnant and you have hypothyroidism, or if you have any signs of hypothyroidism, so that includes constipation, weight gain, low energy, dry skin, among other things, it's really important to get that looked at before you get pregnant, so you can get your thyroid dialed in.
So when we're thinking about making a diagnosis, it's really important that we start with some of the basics. So thinking about what's going on with our cycles. And one of the most powerful tools that we have initially is cycle tracking. So when a patient comes in and has the ability to tell us how long their total cycle is and how long their menses lasts, and can tell us for several months prior, it really helps us get a good pattern understood as far as what's going on. Now, we also like to be thinking about this much before women are trying to actually conceive. And the importance there is that those little follicles that are being released from the ovary that have the egg in them are starting to release 4 months prior to the egg itself actually traveling down the fallopian tube and becoming potentially a fertile egg. So that means that the impact of what we're doing for our body way before we're, trying that cycle to get pregnant is very impactful. So we love to start working with women pretty early on, if we can, even 1 to 2, maybe even 3 years prior to conception, to get their bodies ready to go for that. And if that's something that we're going to come back to as we're discussing this with you guys today, because it's such an important portion of fertility and having, healthy pregnancies. So as far as our cycles, there's all kinds of fantastic cycling apps that you can get for your phone. You can also just do this on good old piece of paper or a calendar. There's also basal body temperature taking, and we're going to go into that and charting that. And that helps reflect what our estrogen and progesterone are doing during our 2 portions of our cycle, and helps us really understand when that LH surge comes on. There's also LH testing strips now, which can be done at home. Very simple. We're going to discuss those because they're wonderful tools. And also we love to talk about cervical mucus, because that is going to affect it'll tell us more about the hormones that are being released, but it'll also affect that travel for the sperm to the egg. And so we want the right environment for that to happen. Cervical positioning also changes throughout our cycle. So that's another thing that we can track as cycling individuals. And so that's something that we can feel inside and feel the position and the openness of our cervix even. So we're going to chat about that today as well. Now, we can also be doing more investigation with things like blood tests. And those can be pretty broad as far as what we're concerned about as the clinician that might be involved. So Dr. Mary and Dr. Rosalie already just talked about several different diagnoses that could be involved. And those blood tests really help us narrow down to make sure that there's nothing standing in our way as far as the fertility piece goes. We also often will want to do hormonal testing, which we prefer to do with salivary hormones. It helps us get a really good picture of what's going on for cycling individuals. And that is done at a very specific time of our cycles. So usually between day 19 and 21 for cycling folks, that we want to really make sure that we are getting the proper release of our estrogen and progesterone during that time. Because remember that progesterone is going to be so important, as we'll talk about later, to help make the right environment of the endometrium to make it a nice, fertile, soft landing pad for that egg. So we also want to check those adrenals, as we saw in that picture with hypothyroidism. Our adrenals and our ovary and our thyroid are very interconnected, and specifically through this brain pathway of the pituitary communicating down with those organs. And then we also sometimes do need imaging, and that will help us understand if there is something like an actual fibroid or something blocking, or if we have an unusual shape of the uterus itself, or if we're dealing with certain closure issues or scarring for the fallopian tubes that might be blocking the release of those eggs. So when we're thinking about cycle awareness, those apps are just awesome. They're usually free, and we've listed several here for you. And those allow you to put in the date of your cycles. It helps you really see clearly the length of those cycles, the amount of days that you're bleeding, and the days that you're not. And then you can also usually track in there what's going on symptom-wise. Are you having depression or getting teary before your cycle? Are you having cramping problems? Are you having irritability? What's going on? Do we have headaches involved, like migraines or something like that? And it allows you on a lot of those apps to go through and actually do a data analysis and look at what your average cycle length is and when you tend to have certain symptoms. So these kind of cervical clues, like the basal body temperature and cervical mucus, can also be put in those apps, which really helps get an even more informed picture about what your menses is doing, what your cycling is doing as far as that hormone release. And then, of course, if we're trying to get pregnant, it's very helpful to know when intercourse has happened, and that can really help us understand a more accurate due date. So when we're thinking about basal body temperature tracking, many of you have probably heard about this. There are specific thermometers that are very accurate, that help you track this change that happens. And what happens is progesterone is a hormone that affects our body temperature. It actually makes us rise a degree or two after that LH surge happens and the progesterone comes on strong. So whenever that progesterone happens in the second half of our cycle, that's really helping fluff up that, if you will, that uterine tissue, that endometriosis, to make that nice fertile landing pad for the egg if it's implanted. So when that tissue is increasing there and that progesterone is affecting your body, you get this rise in your body temperature. So it's really nice to know when your ovulation is happening. You can see, for an example, in this cycle, that this person, this is in Celsius, so it's a little bit harder to see, but that this person's body temperature when they're waking up first thing in the morning. That's what we mean by basal body. So first thing in the morning, they take this temperature and they see a rise of between 1 to 2 degrees. And what you'll see is that progesterone is maintained here until about day 27, and we see this drop. So especially with people who are really trying to get pregnant and really want to know what's going on with their progesterone and seeing if that implantation happened early on, maybe even before some of the testing strips are going to show, if we have that progesterone continue to keep the temperature up, then we have a good indicator that often it means that that lining is not about to shed, and that can be because of a successful implantation. So if we see that drop though, then that often means that we're looking at having that uterine lining shed and that menses start up within a day or two. So this is a great thing to do, and you can usually log it right into those fertility apps, which is really awesome. Or you can do this the old school way, like we used to have to do with patients on pen and paper. But either way, it gives us a really good idea of, are we ovulating or not?
So with cycle awareness, there's sort of, 4 big things we're looking at. Dr. Molly talked about the basal body temperature, and then I'll chat through the next 3. And this cycle awareness piece is something that I recommend to all my fertile patients who are in their fertile years, to ultimately get to know what their body is doing, even many years prior to hoping to conceive. This obviously is an excellent tool for, figuring out when ovulation happens. So with LH surge tracking kits, these are sort of the ovulation kits that you can find over the counter. It's an at-home urine test, which tracks a very specific hormone known as luteinizing hormone, which peaks for 24 to 48 hours just before ovulation. So it's a really excellent way to measure when ovulation happens, so that you can plan intercourse at that time and know that conception is very probable. Fertility is highest during this window, during the fertile window. This is also the time where the basal body temperature rises, right? These tests are pretty accurate, about 99% accurate. So they're a really good tool for people who are trying to just figure out what their cycle looks like. The third tool is tracking the cervix. So cervical position changes are also really common, especially during that fertile window. When that LH surge happens and the hormones are all shifting, the cervix goes pretty high and becomes very soft, like the lips of your mouth. And the cervical os, which is just sort of the donut hole in the middle, opens up, right? Remember, the cervix is actually the word in Latin, it means neck. So it's sort of the neck of the genital system, the female genital system, that sort of has to open to allow for conception to happen. A non-fertile cervix would move pretty low in the vaginal vault and feel firm like the tip of your nose. The cervical os is closed at that point. The fourth way to track the cycle and fertility at home is tracking your cervical mucus, which, maybe the better term is cervical fluid, because it's totally normal in all fertile women to have fluid that is secreted from the cervix. And it can be seen on the underwear, it could be seen on the tissue paper after you wipe. Ultimately, it's worth getting a sense for what that cervical fluid looks like, in the early part of the cycle, as it's becoming, as the lining is building, as the hormones are changing, as ovulation happens, etc. The dry phase is the non-fertile phase, right? Day 1 to 3 after your period, where the cervical fluid very much has no water. You can imagine if sperm are trying to go up into the cervix, into the uterus, they're just going to get stuck. So it's non-fertile cervical fluid. The sticky phase is still not fertile. Again, this is days 4 to 6 after the period. We're starting to see more and more water in that cervical discharge. The creamy phase is when we start to think about the cervical fluid looking like Elmer's glue. And this is where we're kind of semi-fertile, right? The sperm are able to like move around, but not very easily. So this is sort of the period in the cycle where if there's no other birth control on board, it's sort of when you want to start wearing condoms if you are avoiding pregnancy. If you are trying to get pregnant, the clear phase is where the fertility magic happens. Days 10 to 14, we're looking at very stretchy cervical fluid. Again, it's supportive to the sperm swimming up to through the cervix into the uterus and into the fallopian tubes. There's also a wonderful thing called ferning, which is something Dr. Mary taught me about this week, which is when you look at that clear phase cervical fluid under a microscope, it has this beautiful pattern to it. When it sort of stretches out and becomes elastic, it looks like these fern fronds, which is just, I think so beautiful, both, invisibly, but also energetically here.
Okay, so next we're going to move on to some of the tests that we might do in office if someone were to come in with any specifically infertility and also menstrual cycle irregularities. So one of the first sets of tests that we would look at would be tests to measure your ovarian reserve. As Dr. Rosalie was explaining in the beginning of this presentation, you have a decline in your viable eggs over time. In these days, as we have careers that kind of prolong, often for many people, we prolong or kind of put off having kids until our 30s. That's often when we've already seen some decline in our ovarian reserve. And if you're trying to get a sense of how much time you have before, how much time, what your ovarian reserve looks like and how much time you have to conceive in your 30s and early 40s, it's really helpful to look at AMH, and that is called anti-Müllerian hormone, and it's secreted by the egg follicles. And it gives you a sense of how many viable eggs you have. And then we also have day 3 FSH, which is one of those the hormones that Dr. Molly was pointing to in that menstrual cycle chart that stimulates follicular growth. And then estradiol is also a really helpful marker there. And then we have this whole other set of tests for an infertility evaluation where you can look at any potential underlying causes or nutrient deficiencies that may be setting someone up for infertility. So some of those things that we look at are, and we want to look at an iron panel and a complete blood count to look for anemia. We really want iron to be sufficient in when we're trying to get pregnant. We want to look for any vitamin D deficiencies. And then as we were discussing, we really want to make sure the thyroid is dialed in. So look at a thyroid panel, and then many other things like progesterone. Low progesterone is a major cause of recurrent miscarriages and infertility. And then things like diabetes. There are many syndromes where we'll secrete too much prolactin, and that will affect our other hormones. So essentially, there's many different reasons that you can have infertility, and it's important to look at all of your risk factors and get the appropriate testing. Next, we can look at the salivary hormones. We really like to do salivary hormones at Prosper because it's a more accurate way of looking at the hormones and what's active in the tissues. And this is really helpful for getting a sense of our estrogen, progesterone, and testosterone balance. Again, the ratio of estrogen to progesterone will have major influence on the efficacy of our cycle. And so we really like to look at all of those. Testosterone can be a really good indicator for PCOS. Often testosterone is really high with PCOS and can lead to all of those high testosterone symptoms that we talked about. And then looking at cortisol can be really helpful. In the next slide, we're going to discuss the way in which elevated cortisol can affect the production of your other hormones. And with the salivary testing, we can look at cortisol, which is our stress hormone, at different times of the day. We'll often look at it in the morning, afternoon, and evening. And what we like to see is a nice rise in the morning and then this slow curve of a decrease throughout the day that allows us to sleep more easily. So kind of helps us wake up and then go to sleep in the evening. And this can often become dysregulated, whether it's too high throughout the day, too high at night, or too low in the morning. And this can really affect our hormone production. So here's a slide where we're talking about the cortisol steal hypothesis. So again, cortisol is our stress hormone. You may have heard of the relationship between stress and infertility. And one of our hypotheses that has played out in clinical practice is when cortisol is really high and all of these precursor hormones for our sex steroid hormones like progesterone and testosterone and estradiol, when all of those precursor hormones are being shunted into producing cortisol, that can take those, that can prevent the production of progesterone and estrogen that are really important for our fertility. And so that's an interesting kind of mechanism of why stress is so impactful when it comes to fertility. All right, and so lastly with diagnosis, we have imaging. This really allows us to look at the anatomy of the uterus and the pelvis and ovaries and see if anything anything structural is happening that would prevent that passage of sperm, that passage of eggs, and implantation. So the first thing we often start with is a transvaginal ultrasound. This is a procedure kind of similar to what you get throughout stages of pregnancy, and it's relatively non-invasive. Then we have a hysterosalpingography, which is represented on the right-hand side here. And in this one, this is done through an OB-GYN, and they'll inject a dye into the uterus so that they can then do an X-ray and see if there's any blockage of the fallopian tubes that's preventing the eggs from getting into the uterus and preventing the sperm and egg from meeting. And also just kind of shows if there's any massive fibroids or any distortion of that uterine anatomy that would cause problems. We also can use a scope, so in hysteroscopy, in which you put a scope into the uterus, and that is used to remove fibroids and take biopsies. And then we can also do an MRI. This is imaging that allows us to look more specifically at structures on a microscopic or kind of a more small scale level. And so that type of imaging and a laparoscopy, which is actually a surgery where they put a scope into the pelvic cavity and can remove tissue. Those two are what's actually needed for the diagnosis of endometriosis. So that's what I was referring to before, why it often takes so long to get that definitive diagnosis. Because the ways to diagnose are relatively invasive. All right, so next we can move on to how you can treat your infertility and menstrual cycles at home. And I'll send this back to Dr. Molly.
So we just want to recognize that this can be a very complex issue, and it can also be an issue, especially when we're looking at challenges with fertility, that is very emotionally triggering for a lot of people. And it's one that we absolutely love to help people walk through. And one of the beauties in the naturopathic approach is we really are trying to take a step back and look at you as a whole person, and look at your partner as a whole person, and look at your balance in regards to not just your hormones, but also what's going on in your life as far as stress factors and other triggers that might be getting in the way, other obstacles for us. So we really just want to encourage anybody who's experiencing any of these imbalances or challenges around regulating their menses or around fertility to make sure that they are taking the time to explore that deeper. So when we're coming up with these, what we call health hacks or supports, we really want to just recognize, first of all, that each of us are individuals, and some of these address things like estrogen imbalance, which is causing progesterone to be low, and others are addressing not enough estrogen. And we see this in a lot of athletes and people who are maybe too thin, or perhaps have hyperthyroidism, something that is suppressing their ability to have this proper estrogen amount that supports our fertility. So with this cycle, it is absolutely all about balance. So when we're talking about these things, I just want you guys to keep that in mind. And as we work with our patients, we really try to individualize a lot of our treatment strategies. So we're going to start with talking about diet, because that so implicates so many changes for our body. Remember, our DNA is actually affected by the food that we put in our body. We're going to talk about xenoestrogens and why they can really be problematic for fertility. We're going to talk about exercise and stress management. We're going to jump into info about herbal medicine and supplements that we've found to be really helpful for our patients with menses issues or fertility issues. And we're going to talk about uterine massage and pelvic floor therapy as well. So first off, let's talk diet. Our number one goals with diet when we're thinking about regulating the menses and supporting fertility is going to be to reduce inflammation. Now, inflammation can be caused by many different things, but we know that this inflammation causes an increase of what we call prostaglandins. So these chemicals affect our uterine lining, and that's a big deal. So we do not want things that increase our inflammation. That can lead to unhealthy pregnancies, and it can be very problematic as far as blocking the entire fertility process. So, and it can really disrupt our menses and cause more painful bleeds, things like that. So we want to think about what might be triggering inflammation. We also want to be thinking about blood sugar regulation. And we know that this plays in very significantly for our PCOS patients. It's a big deal. It's something we're talking about quite a bit. We know that blood sugar also communicates with our cortisol levels in our body and can be seen as a stressor for our body too, which drastically affects fertility. We also want to be thinking about ways to support our hormone metabolism, making sure that we're getting excessive hormones out and we have the building blocks to make our hormones. So some things we like to include are omega-3s. Now, these fatty acids are incredibly anti-inflammatory. They're also going to be really important building blocks, fats, which are building blocks not just for our hormones, but also going to be helpful building blocks for a baby if that's our ultimate goal. We also want to be making sure that we're getting whole foods, organic foods, things that aren't overly processed. Of course, we want to avoid these chemicals like pesticides. We know that they drastically affect our ability to be fertile as well. We see this both in animals and human studies. Now, we also know that fruits and veggies that are the color of the rainbow and really rich in antioxidants are going to be helpful as anti-inflammatories. They're going to promote healthy babies and healthy eggs and sperm. So we want to be involving those. We also know that isoflavonoids are a really beautiful type of antioxidant that is found in these phytoestrogens, and we're going to talk about those in more detail. And we know that brassicas are broccoli, cabbage, and cauliflower, kale, that family of veggies have constituents in them, have these wonderful phytochemicals in them that are very strong antioxidants. They help reduce inflammation, and they can help with hormone excretion, so we can help have a balance and not have an excessive amount of certain types of hormones. We know fiber also helps with removing excess hormones, particularly estrogen, if we're worried about an estrogen dominance. So things we generally want to avoid are things that we know that are inflammatory. So that's our processed foods, it's our chemical laden foods with synthetic ingredients, it's our red meats, unfortunately, because they're higher in arachidonic acid. And that comes with a caveat of if you have organic grass-fed red meat, to me that comes in a little bit of a different category, but we do want to be careful of things that increase arachidonic acid, which is pro-inflammatory. Of course, our fried foods and those overprocessed foods and the excess sugary foods are all going to be what pushes inflammation the most for many of us. And then we want to avoid the alcohol. For many of us, that goes without saying, but that's going to affect, remember, 4 months prior to that cycle that you're trying to conceive, that follicle is being affected by those chemicals that we're putting into our body. So we have quite a long period of time that we want to abstain from alcohol use and caffeine use. Unfortunately, caffeine has been shown to be a deforming agent in regards to pregnancies. So we want to stay away from excessive amounts of caffeine too. Now, when we're thinking about these healthy fats, we can include these in things like fish in our diet. We can, of course, supplement with fish oil. We can include things like good quality butter, especially that's been grass-fed, from cattle that have been grass-fed. We want to be thinking about cold pressed extra virgin olive oil, things like flax oil, which will help as a phytoestrogen as well. And then also things like coconut oil, egg yolks particularly contain this choline, which is really important for the fertility process. So including those in your diet if you tolerate eggs. And then our seeds and nuts are great builders for these fats, which help promote that balance between our estrogens and our progesterones. And then things like avocado also are fabulous vegan sources of protein. In regards to our phytoestrogens, we can get these in things like soy, flax seeds, sesame seeds, even in certain herbs like licorice and hops and red clover. And these contain these really beautiful phytoestrogen antioxidant compounds, specifically our isoflavonoids and our lignans like genistein, which help us act as if they are estrogen. So for people who are dealing with infertility issues and may be lacking estrogen, and that's their big challenge with their fertility, these can be really beautiful chemicals that are naturally derived and can be included in diet to support that estrogenic effect. They can also help block excessive amounts of estrogens when they're coming in that may be forms of estrogen that are not helping our system with the fertility. So we have these different forms of estrogen, and that's something we often will look at with our patients as far as what forms of estrogen they're creating. So brassicas, I mentioned before, these are that broccoli family, the cabbage family. Those cruciferous veggies are going to contain several components. One is called DIM, and another one is SGS, which has the sulforaphanes. Now, these are very, very potent antioxidants, and they promote the conformational change of estrogen so that it can be excreted out through our stool, so we don't end up having these toxic levels of excessive estrogen, which is very common, especially in our American society with excess weight and things like that. Because remember, our adipose tissues are going to be storing excess estrogens.
Thanks, Dr. Molly. So moving on from diet, which is, the fundament here, there's other layers that we can add on in terms of promoting fertility. And our health hack number 2 is avoiding xenoestrogens. Xeno means foreign. Okay, it means alien, it means not human ultimately. So these non-human estrogens, they bind to our estrogen receptors, both male and female alike, causing an estrogen stimulation. When there's too much estrogen, there's sort of a functional low level of progesterone, which is our progestation hormone, right? So xenoestrogens are found everywhere these days. They're found in plastics, from phthalates to BPA, which you've probably heard about, from dioxins that are in fertilizers, etc. So removing xenoestrogens is a huge piece in helping with hormonal management because of this estrogen stimulation. So how to avoid them is essentially to remove plastics as much as you can from your life. Store food in glass containers, avoid heating food in plastic or even, the styrofoam that you get takeout in. Look for phthalate-free products, right? Phthalates are found in all sorts of things, from beauty creams to body lotion. If you want to follow the link to a website that kind of lists out which products are safe or not, it's a governmental site known as EWG Skin Deep. It's just a quick Google search that can sort of help you navigate which products you might be using that could have xenoestrogens in them. Eating organic is important, again, because we've sort of removed the fertilizers and the pesticides, which also have these xenoestrogens in them. Sweating is a big piece because sweating is helping move and mobilize fat tissue, and hormones are made of a cholesterol backbone. Okay, so they're stored in the fatty tissue. Sweating helps move through excess hormones and prevent the buildup of estrogens and xenoestrogens. Health hack number 3 is exercise, right? It's sort of paired pretty closely with sweating. We want sweaty exercise to be part of the routine here. It's definitely a balance, like Dr. Molly said. One of the big causes of infertility, especially in our young athletes, is just overtraining, right? Think of our super thin marathon runners who are just no longer menstruating. There's just not enough fat on their bodies to support healthy hormones. And then, so not too little, but not too much as well is definitely big here. And that varies from person to person. But what is just general tips in terms of exercise is to have a regular routine. Okay, is it 30? Is it 60 minutes? Is it 5 days a week, 7 days a week? Whatever you can do to sort of support the sweating phase and just get circulation moving. Weight loss regimens are not recommended when you are trying to conceive because they're depleting, right? So we've got to keep weight stable, if not aim on building muscle mass, right? Avoiding scuba diving seems sort of, intuitive here, as well as rigorous calisthenics. For PCOS specific, that polycystic ovarian syndrome, studies have shown that 60 minutes of aerobic exercise 7 days a week, including 20 minutes of strength training, has been shown to sort of help with PCOS related infertility. Another big piece here, health hack number 4, is stress management. And like Dr. Molly shared earlier with the cortisol steal hypothesis, the cortisol is another hormone with that cholesterol backbone that if we're chronically stressed, we're not able to make more of the sex hormones that are needed in very specific amounts in order to support fertility and conception, right? High stress leads to anovulation, right? If you're not ovulating, you're not able to be fertile, leads to inflammation, painful menses. Stress management is something we talk about probably in every doc talk, right? It has far-reaching effects. But some mindfulness techniques that are really helpful include progressive muscle relaxation, diaphragmatic breathing, including Ayurvedic pranayama or breath work. This is also good for relaxing the pelvic floor and the pelvic organs, right? Which might be a place where people hold their stress. Yoga and Tai Chi, again, just movement regimens that are stress relieving as well. Meditation, from guided meditation to mindfulness practice, is something that is recommended definitely on the daily, however you can fit it in to help with diminishing that cortisol, that stress hormone. Community and belonging is another big piece here, right? It has to do with oxytocin. It's the hormone that gets released when we feel like we belong, right? And so that's another big important piece for stress management. And then lastly, finding ways to boost endorphins with laughter, exercise, intercourse, massage, somatic work. All of these things can be part of a greater regimen for increasing fertility.
Okay, so next we're going to dive into herbal medicine for infertility and for menstrual cycle imbalances. And first, I'm just going to take a second to explain what is happening when we have menstrual cramps, and that'll help us understand how we're using herbs to treat them. So when we're getting ready for menses to start, at the end of the second half of the menstrual cycle, we'll see a steep decline in progesterone. That stimulates the lining of the uterus to break down. And that breakdown can cause a release of inflammatory, what we call prostaglandins. Those are markers to our bodies stimulating inflammation and telling our immune system to come on board and start working. This often causes our blood vessels to constrict, and which then causes the uterus to contract. And that decreases the availability of oxygen to the uterus in that area, and then increases nerve sensitivity from that decreased oxygen. So it's this kind of combination of the inflammation leading to increased cramping and the decreased oxygen enhancing that our nerves stimulus that feeds back to our brain. So here we're going to talk about herbal medicine and specifically how we're addressing that inflammatory piece that we just talked about in the menstrual cramp cause. And then we're also going to discuss the decreasing that endometrial inflammation, helping relax the smooth muscle, or that sort of the muscles of the uterus, and then also helping with hormone regulation. So some of the herbs that are really helpful for menstrual cramps are ones that relax smooth muscle. These include wild yam, valerian, that's often in sleep formulas, passion flower or passiflora, and then cramp bark is a really popular one as well. And these are often working on GABA and natural opioid pathways to help relax that smooth muscle and prevent that tightening that causes the pain in menstrual cramps. We also want to decrease the inflammation within the uterus. And we can do that with herbs like ginger and turmeric and willow bark. So ginger and turmeric are actually working, well, first of all, turmeric is working on an enzyme that, working to inhibit this enzyme that produces those inflammatory cytokines. Actually acts similarly to things like ibuprofen and aspirin, or what we call non-steroidal anti-inflammatory medications. And so we have turmeric acts on what we call cyclooxygenase enzyme, and then inhibits a number of other enzymes that do the same thing or similar things. And then we have ginger also inhibits the release of other inflammatory cytokines like tumor necrosis factor. And then willow bark, interestingly, is what aspirin was originally formed from. And this contains a molecule called salicylic acid that again acts on those cyclooxygenase enzymes that, and when you bind to those and stop them from working, it slows down that inflammatory cascade. And then our last section here, we've got the hormone regulating herbs. So Vitex is one of our main herbs that we use to help regulate the menstrual cycle. It acts by preventing the release of prolactin, which is a hormone that can decrease progesterone. So this herb is really helpful for boosting progesterone and regulating that second half of the menstrual cycle. We also really like to use maca as a pretty strong phytoestrogen. And this is really helpful for supporting that first half of the menstrual cycle where we want estrogen to be really prolific. And then lastly, we have saw palmetto. This is a really great herb for quenching testosterone. So remember in PCOS and other menstrual imbalances, testosterone can get really high. And this inhibits an enzyme that forms a really potent form of testosterone. It's really useful in those conditions. And here, this is just diving into chaste tree or vitex a little bit more. Again, this is one of our main hormones for regulating the menstrual, or sorry, not main hormones, main herbs for regulating the menstrual cycle. And you can look back at this to understand the mechanism, but it's a really well-studied herb that we find very effective in helping regulate our cycles.
We love Vitex. Okay, so now we get to talk about supplements. So mind you, this is such a massive topic that we could just go on and on. So we've tried to really choose some of the most impactful supplements that we have found to be helpful in categories of those. So we're going to talk about things like estrogen metabolism. We're going to talk about ways to reduce that endometrial inflammation, because we've talked about why that's such a big deal. We really want to support that environment, that vaginal environment, so that the sperm can be successful on their journey. And we want to be thinking about prenatal vitamins being on board, of course, so that we're having a healthy start and finish of our pregnancy. And then we want to be thinking about ways that we can support these cycles so that we're not having these hormone imbalances that are triggering PMS and challenging issues with our cycles. So let's talk about ways to support this estrogen metabolism through supplements. One of our most well-researched forms is DEM, and then we also have calcium D-glucarate. So when we are thinking about our estrogens, I mentioned it earlier, we've got kind of these good estrogens and these bad estrogens. And depending on our types of estrogens and how they've been converted, some are going to put us at higher risk of things like breast and ovarian and uterine cancer. And some of them are going to be more protective for those tissues. So we think about these, and we've written them out for you here so you can refer back to them. But we think about the ratios of these hormones that your body is producing. And we really want to promote this healthy estrogen conversion. And we can do that not just with those brassica, broccoli and cabbage family foods, but also with taking extracts of things like the DIM, which we can get in supplement form. So when the estrogens are being excreted, we have them packaged up by the liver, taken out through the bile. And there's something called the estrobolome, which was new to me, which is essentially like this microbiome of probiotics, good flora that sits on the enterocytes of the colon, sits right there in the lining of the colon. And they help with that conversion of these bad forms of estrogen into these safer forms, and then allow them to be excreted out. So allow us to poop out this extra estrogen, which is very, very damaging. So we know that these good probiotics contain these brush border enzymes called glucuronidases. And we can even do tests to see how much a patient has through stool testing, which is pretty cool, of these specific enzymes. But these good microbes help us basically get that estrogen out, and we can support that pathway by supplementing with calcium D-glucarate, which isn't just a calcium supplement. It's this actual chemical which helps really support this glucuronidase action and help decrease this estrogen recirculating throughout the body. So we don't want that estrogen to be in that dangerous form and to be reabsorbed. That's going to mess up our fertility and put us at greater risk of these estrogen dominant style cancers. We also know that fiber as a scrub brush can come in and help out with excretion. So sometimes we're even supplementing with fiber here, not just through our food, but also in a capsule form or a powder form. So this is one of our most commonly used calcium D-glucarate supplements, and we wanted to just give you the science behind how it works to help excrete that excess estrogen. And it does this with other toxins too, not just those estrogens. So we also want to be thinking about anti-inflammatory supplements, because we know that inflammation can really affect our menses. It can really affect our fertility. So some of the best studied anti-inflammatories are things like resveratrol, pycnogenol, and then our omega-3s and those fish oils like the EPA and DHA. Now that's handy to be taking and supplementing with those omega-3s, because we're going to need them to build baby brain. So if we're working on fertility, we want to make sure that we are getting enough of those in. And often that requires supplementation specifically of a fish oil that has enough DHA, because that's really the brain food. And the neural tube, remember, is formed in the first 8 weeks of pregnancy. So sometimes even before people know that they're pregnant, that neural tube is starting, and we need those good fats on board. And then curcuma veil, which is a form of turmeric, can be a really strong anti-inflammatory too. And we know that that is going to help us with regulating that menses and helping us with our fertility. So Certain things that we can do to add in just to support normal menses cycle and make sure we have enough of the building blocks for a healthy fetus and baby is we want to make sure we have our prenatal vitamins on hand. So specifically studied is folate. Many of us know this as folic acid. Now, folic acid is actually a synthetic version of folate. We're looking for our patients to be on methylated folate, and that's really important, not just for the absorption, but also because it does act different in the body to have the natural version of folate. So when we're getting those prenatals, we want to read the label and make sure it doesn't just say folic acid. We want it to say methylated folate. We also want to make sure we have some B6 on board. Iron is important, especially if somebody's been experiencing some anemia, and we know during the process of pregnancy, we have a higher risk of becoming anemic. So having that iron on board can be really helpful in the prenatals. A good quality B12, sometimes some vitamin D, and even choline. Remember, I mentioned that coming in the egg yolk. We know that that's helpful for building a healthy baby. So there's another supplement that we've used at our practice here called AvaBlend. This one's more geared for PCOS patients, and it helps promote that healthy luteinizing hormone to help make sure that our women are having a successful ovulation mid-cycle. Now, we also want to support that environment in the uterine tract and in the vaginal area. So we also know that there are good studies showing that certain lubricants can be really helpful to make the right viscosity of that cervical fluid. And one of the things that we can use is there's a brand called Good Clean Love, which is a clean version of this type of lubricant that can be used during intercourse to help the success of that sperm make it to its goal of the egg. And we also know that certain herbs, which we've already covered, for example, like chaste tree or vitex, can support our progesterone. And we know that for fertility, we want to keep that nice lining of that uterus. Remember, we want that nice supple lining for the egg to land. And so having things like Vitex on board can be a helpful strategy for some patients with maintaining pregnancy. Also, PMS support, if that's something that you're impacted by, or PMD, both of those are going to be supportive. We know by certain B vitamins, like B6 has some good research behind it, and certain serotonin building blocks by like 5-HTP can be really helpful to reduce some of that tension and some of that irritability and mood swings that happen before we menstruate, when that progesterone starts to really crash down. Now, as far as liver and detox support, that's really critical, but to happen before we're trying to get pregnant. Remember, because that 4 months prior, we're already percolating that little follicle, getting that egg ready to go for release. So anything that egg is affected by as it is released from the ovary is going to be impacted. So if we're detoxing and have a whole bunch of toxins moving through, that can be not a great thing for us for our goal of healthy pregnancy and healthy baby. So we want to be thinking about that, but much before, and that helps with regulation of abnormal cycles if that's something you're impacted with. So the last thing I want to mention here is progesterone. Progesterone, once again, that nice supple uterine lining, can be really helpful. And we use this in our practice depending on the severity of what's going on for the patient, how long they've been dealing with fertility, or if they have history of multiple miscarriages. We're talking to them about bioidentical progesterone, either coming in an oral form, in a micronized compounded version, which we're prescribing to patients, or we're prescribing a topical version, which is often derived from wild yam, that is also a progesterone, which can help really support that uterine lining and making sure we're not having a dip, which is promoting a menstrual cycle, which would ultimately release any kind of fertilized egg and result in a miscarriage. So those are kind of the tools that we're using here in our practice to support fertility from the naturopathic side, thinking about different kind of supplements. Now we want to talk about a really exciting component which we've recently added to our practice. Dr. Mary.
All right. So this is one tool that I've recently started practicing at Prosper, and it's uterine massage and pelvic floor therapy. So it's a form of therapy that's really good at bringing blood flow, helping with lymphatic drainage in the pelvic area. And it is often involves a gentle body work for the pelvic organs and digestive system. So really helpful with any ovarian dysfunction or uterus dysfunction, just kind of supporting those structures, and gently allowing for the breakup of any adhesions that have happened from long-term inflammation in the pelvic region or any prior surgeries. And so the process is often gentle body work and then trigger point release of the pelvic floor muscles. So the pelvic floor is a hammock of muscles that exist between our pelvic bones and underneath our bladder and uterus. And it helps hold all of those things in place and helps hold our joints in place. And it often, when you have any pelvic floor dysfunction, can often happen after any physical trauma or childbirth. You can have either tightness or laxity in those muscles, and that can cause low back pain and many other things. But in relationship to menstrual dysfunction and fertility, this is a really great way of just gently supporting yourself throughout that process. So really great for any pain with sex that may be impacting your ability to get pregnant, endometriosis, polycystic ovarian syndrome, and painful menses.
Thanks, Dr. Mary. So now's the exciting time in the Doc Talk where we sort of switch from the naturopathic perspective into the Eastern medical perspective. So I'll be talking just quickly about the Ayurvedic medical approach to infertility, and then Dr. Mary will give her expertise on the traditional Chinese medical perspective. So just briefly, Ayurveda is the traditional medicine of India. It's Sanskrit for the science of life, essentially how to live one's life and increase their health span. The root cause of both male and female infertility is something known as low ojas. So ojas is a Sanskrit term for life force. And in order to build that ojas, there's just general treatment guidelines here. First, you've got a detox prior to conception, many months prior. And then during the conception boosting, the fertility boosting phase, that's where we boost kapha, which is our earth and water elements, and we decrease vata, the air and space elements. And we do that by tonifying all of the tissue layers with rasayana herbs, because there's 7 tissue layers in Ayurveda, from what you take into your mouth sort of builds over 7 different cycles, all the way to the 7th one, which is essentially your sexual reproductive tissues. And so in general, the detox phase prior to conception is going to be something known as panchakarma, which maybe you've heard of before. Pancha means 5 and karma means procedures. There are 5 cleansing procedures that stimulate the body to detox prior to sort of rebuilding the tissues. To rebuild the tissues, we boost kapha. It's our water, our earth, our grounding elements, right? And we do that with foods and methods that have the similar energetics. So boosting juicy and sweet foods like coconut and dates, or oily foods like avocado and ghee are going to be very helpful. Decreasing vata is also paramount here. It has to do with stress reduction, ultimately, both physical and emotional. And the best way to ground that vata, the air space element, is with routine. Just making sure we're eating at the same time of day, going to sleep at the same time of day, having an exercise regimen, having a self-care regimen, a meditation regimen, stress management, both internally in terms of what you're eating. Is it stressing out the organs? And externally in terms of what is stress like in your external world. Abhyanga is a really easy way to ground vata. It's something we even do on brand new babies. It's a regular oil massage of the whole body, right? You're sort of adding the earth and the water element to the air and the space. And then lastly, those Rasayana herbs are paramount here. Ashwagandha has a lot of good data on boosting female, but also male fertility. It's mostly a sort of our male herb in Ayurveda that is Sanskrit for the smell of a horse. So think of the stamina of a steed, right? So ashwagandha brings that energy. Shatavari is its counterpart for the female. For the females, and it stands for 100 husbands, right? It just boosts fertility and tonifies those tissues in that way.
Okay, next we'll talk about traditional Chinese medicine and acupuncture and Chinese herbal medicine and how I use it in practice for treating menstrual issues and fertility. So just some sort of basics of the Chinese medical system. We have these things called organs that are these metaphorical systems that describe the different functions within the body, and they're related to the Western organs, but not the direct translation. So I'll talk about them, but remember that they're not the same as the Western translation of these organs. So the kidney in the Chinese medical system is responsible for growth and development and reproduction. So infertility, especially associated with any congenital issues or with aging, is often seen as a kidney deficiency. And then we have the liver in Chinese medicine. Its job is to distribute blood and qi throughout the body. And it also it's where the blood is stored. The blood is this concept of nourishment and lubrication, and it's really important for pregnancy because you're growing a new human, and the blood is kind of like fertile soil that everything flourishes from. And so as you get towards conception and throughout pregnancy, you really need to pay attention to building blood through food, through herbs that we'll discuss later. Spleen qi deficiency is the digestive function is impaired, and that prevents us from absorbing nutrients from our food that allows us to build blood. And then we have this concept of blood stagnation that is often causing things like endometriosis and fibroids. It's this kind of conglomeration of blood where it's not flowing easily. And then blood deficiency again can lead to infertility. So our goals here are to tonify and invigorate the blood, to clear blood stagnation in the uterus, preventing endometriosis and uterine cramping, to soothe the liver and tonify the spleen and the kidneys. All right, so we have this wonderful tradition of Chinese herbal medicine that's very well studied for endometriosis, PCOS, infertility. And some of my favorite herbs within this system are white peony, Dangui or Angelica sinensis and Chaihu or Bupleurum chinensis. And these are all acting on different organs. White peony from the Western biomedical realm is known to modulate estrogen and prolactin and reduce testosterone levels. And in Chinese medicine, it helps to tonify the blood and nourish and preserve yin. Yin is, again, another nourishing kind of female element of Chinese medicine. And then we've got dangui. This is a very popular women's herb, and it's used for all things, all issues with the menstrual cycle, particularly pertaining to blood stasis. So it helps with pelvic blood flow and really great for reducing cramping. And then we have chai hu that helps spread liver qi. So remember the liver kind of when you have liver qi stagnation from a lot of stress, you can have really bad menstrual cramps. So that's again really helpful for that, for relieving menstrual cramps and helping fertility from that perspective. I also really love to use acupuncture for regulating hormones in the menstrual cycle. It's really helpful for fertility support and IVF support. So often folks will come in right before IVF treatment or right before ovulation when they're hoping to get pregnant. And it's really helpful for relieving stress and kind of opening, helping the free flow of blood and qi. And then also is really great for pain management. So if you have any of these menstrual cramps or pain syndromes like endometriosis, really helpful to come in right before your menses or the month leading up to menses. And then through diet and lifestyle in the Chinese medical system, we really want to keep the uterus warm and eat warm cooked foods and lots of dark colorful fruits and vegetables and things like bone broth for building blood. And then we want to have consistent, moderate exercise. And because in Chinese medicine, it's really all about balance.
So we know that this has been a ton of information, but we really appreciate you guys sticking with us. And I hope that you got so much out of it. We tried to cover a bunch of stuff, but even so have left out other causes that might be involved in fertility. But just please know that getting that assessed as an individual makes a huge difference for you. And we want to invite you to our next Doc Talk, which is going to be May 10th on memory and dementia support. So please make sure you sign up for that. And once again, if you're feeling like you're experiencing some imbalance, either in your menses or struggling with fertility, or even just want to start preparing for fertility that may be even 5 years out, as far as a conception plan, we are here for you. And we just absolutely are so honored to work with different families. So please feel free to check us out on our website or give us a call and we can help you out. Thanks, docs, for joining today. And thank you all. See you guys next time.